low-dose aspirin, and ovarian cancer risk. Anti-inflammatory medications may play a role in ovarian cancer risk. A study found that taking low-dose aspirin regularly appears to reduce the risk of ovarian cancer by 23%. However, long-term heavy use of ibuprofen, naproxen, and other non-steroidal anti-inflammatory drugs seems to increase the risk. The data from 200,000 women showed that 1,054 of them went on to develop ovarian cancer. Researchers found that women who took at least 10 doses of inflammatory drugs per week for multiple years had an increased risk of ovarian cancer. Women who took low-dose aspirin regularly seemed to have a reduced risk, but the same was not true among women who took a standard dose aspirin. This channel is made to help you know your body better. Don't forget to subscribe and turn on notifications so you won't miss any videos in the future about your body.